it's very important for me to understand that the patient understands what they're about to undergo before the surgery. And this is not just about the risks and benefits of surgery, but it's about the whole package. It's about how can we make sure that the patient is in the best condition before the surgery, that their nutrition is maximized, that their exercise level is maximized, and then about what to expect when you come to the hospital, about who's going to be involved in your care, what's the role of the nurses, what's the role of physical therapists, and then finally what the recovery is going to be like, how are we going to get them back to where they began. In terms of my best practice for improving the patient experience, I think that when people approach medicine, there's a lot of uncertainty in terms of patients when they come into the hospital. There's so much unknown. What's going to happen next? And a lot of these things the patients can't control, and a lot of things we as providers also can't control. But there are things that we can control. And I think in terms of the two most important things that we can control are safety and quality. And how can we do that? How can we improve safety and quality? I think it's really about communication. It's about making sure everybody's on the same page. But I think it's about building a system where we can ensure that communication exists. My advice for improving patient safety is, at the end of the day, listen to the patients, because our patients are going to tell us what they need and what they want. They're also going to tell us what's wrong with their bodies and how we can help them better. And I think that if we can listen and if we can communicate, and then if we can relay those concerns, not just back to the patient, but to the patient's families and to the medical teams that we work with, engaging everyone who works within this healthcare system, I think we're going to achieve quality and safety.